All right, excellent. Well, welcome everybody. Welcome everybody that's here live with us today, and those of you who will be listening in on the recording. So today we're going to talk about a number of holistic practices as it relates to end-of-life psychedelic care. I'm going to assume that all of us are here because we know the value of holistic practices, that we're just not here to help our patients or clients with their physical symptoms, but we're here for their emotional, their spiritual, and their mental well-being, as well as our own, by the way. We'll talk just a little bit about self-care practices as well. So let me go ahead and share my screen. If you could refrain from putting questions in the chat, because it distracts me, maybe distracts others. And then when we get to the end, let's give you plenty of time to raise your hand, and we can answer questions. Okay, just a little bit about me and how I got here. One of the well, I've done a lot of different things in the professional arena, and one of them was own a 250 client home healthcare agency here in Sarasota that I sold to our regional hospice agency. After that, I did a number of different things as well. And along the way, I got 3 certifications through Deepak Chopra's program. So in Ayurveda, in meditation, and in his total well-being and coaching program, which did pull in everything. And like I say, address spiritual, mental, and emotional well-being. And then I'm also a neuro-linguistic programming coach. I am a graduate of the 12-month Psychedelics Vital program, finished that up almost a year ago. And then along the way, I also did some work for a psilocybin retreat in Jamaica, who was one of the first to develop end-of-life programs, both from a training side in terms of training anybody in an end-of-life or wanted to be in an end-of-life related field, and offered psilocybin experientials. And now I'm the founder and executive director of end-of-life psychedelic care, and I'll come back to that at the very end. So today, I just wanted to make sure we all had a grounding in the psychedelics that at least I normally talk about when I give these presentations. Talk a little bit about why I feel the mystical experience is probably the most important reason why people toward the end of life do so well with psychedelics, especially psilocybin. Share a few stories. We'll touch on health considerations. Pretty much they're the same across the board, but we'll just touch on that. And then we'll sort of pivot into talking about serving clients or patients at the end of life and what some of those holistic practices could look like. And from my perspective, these are practices that any of us can do. You do not need to be a massage therapist. You do not need to be a certified yoga instructor. Basically, these are things that I think all of us can do for all of our clients. And then we'll end with well, what are those tough questions that come up when we are serving people toward the end of life? And I guess let me qualify too. When I say either end of life or toward the end of life, I am really talking about any individual who has been diagnosed with a terminal or life-threatening illness and has begun to experience, we'll call it, existential and psychological distress. So the psychedelics that I normally talk about include psilocybin, ketamine, MDMA, and to a lesser extent 5-MeO, because I'm just learning about it. But psilocybin is the most researched in this field as it relates to cancer patients. And of course, it's becoming legal in states like Oregon and Colorado, and a number of other states are looking at either ballot initiatives or legislation, which is totally cool. Ketamine, because it is legal and it has been shown to be efficacious for both severe chronic pain and for mental distress. MDMA, not as much research, but we know it's really a great heart opener for anybody who wants to work on either self-compassion or compassion for others. and then 5-MeO-DMT as potentially a psychedelic that could serve people when they're really close to end of life. It's a shorter journey and brings you in touch with your God in a lot of instances. So I'd just like to touch on the research here as it relates to end of life. So the sort of granddaddies in the modern era, what I think of as the modern era, because LSD was researched by Stan Grof in the 50s and 60s. So you looked at UCLA published in 2012, but the two big studies were Johns Hopkins and NYU in about 2016. So those lighter blue lines there, or bars, represent the percentage of reduction in anxiety. So this is a statistical significant reduction. And for Johns Hopkins, fully 83% of the participants reported a significant reduction. At NYU, it was more like 58%. Johns Hopkins study was 2 psilocybin sessions. NYU was 1 psilocybin session. The red bars represent anxiety, the red bars represent depression. And fully 78% of the participants reported a significant reduction at Johns Hopkins, while 83% reported a reduction at NYU. Now, fast forward to 2023, and this is why I think psilocybin is so important in this field, because what Sunstone Therapies did is they extended their surveys out into 18 months, but at the primary endpoint, fully 80% of the participants reported a reduction in depression, and they only looked at depression. That more medium blue bar showed that, again, at the primary endpoint, 67% of the people reported being in remission. Then fast forward 18 months later, fully 57% of the people reported being in remission. Let me go back and restate that. I realized I said that wrong. So that blue bar represents the percentage reduction at 18 months, but 57% of the people were in remission at that point in time. So phenomenal results. You rarely see this kind of a result in psilocybin studies for other mental health and other disorders. For anybody who's interested, and you all will receive these slides, so for anybody who's interested, here's a number of psilocybin studies that are either being planned or are recruiting at this point in time. And as many of you might know, clinicaltrials.gov lists all the studies, and all you need to do is put in the various keyword searches, and you can find out about it in any of these. So I'm not going to go into that. I wanted to talk about ketamine because I think it's really important, if for no other reason than it is shown to effectively treat chronic pain. And that includes complex regional pain syndrome, neuropathy, fibromyalgia, and others. These things are really important for people in palliative or hospice care. And we know that there is a direct link between depression and chronic pain. And if you can reduce chronic pain, you can reduce depression. So I think ketamine is just a phenomenal option for people who are suffering like this. One of the things about ketamine is people may die before they die. I know that also can happen with psilocybin, but as a dissociative anesthetic, people have that experience of being separated from their body, with knowing that they're coming back. The other thing I really like about ketamine is the potential for at-home treatment. So even in places like Oregon, where psilocybin is now legal, you have to go into a licensed service center, so that somebody who cannot travel from their home and may be bedridden, there is no option for them right now in terms of legal alternatives in Oregon, as it relates to psilocybin. So ketamine becomes a viable option. And as I mentioned, for anybody who heard up front, Susie is an end-of-life doula, and we're working on a small at-home ketamine pilot where palliative care physicians will be going into the home and treating palliative care or hospice patients with an intramuscular injection. The other thing about at-home treatment is it can take various forms, like an IM or oral or rectal, which bypasses the liver, which can be really important for people toward the end of life, and or nasal spray. And, you know, as we all know, we meet the client where they are. And so some clients may prefer a medical model. And so this is a really viable option for them. And just to show it, this is only 2 studies, but again, you see some very significant results. The University of Toronto study looking at depression only found that 70% of the participants reported a significant reduction, and then 47 reported being in remission. The study on the right was done in a hospice agency. It was a small study and it was oral ketamine. However, every single hospice patient that finished that study reported significant reductions in both depression and anxiety. So again, pretty phenomenal results. And what's really interesting about the ketamine therapy studies is that for the most part, first of all, for the most part, they used infusion therapy, IV infusion therapy, and it was weight-based at 0.5 milligrams per kilogram. However, we know in real life scenarios, and anybody who's really familiar and experienced as a practitioner in ketamine therapy knows that many of us who suffer from depression and anxiety require a much higher dose. And a lot of these studies did not include psychotherapy. So we also know that the results of these studies or the results in real life actually can be much better. So just something to keep in mind if you love to review these studies. And again, if you're interested in learning more, here's 4 studies that I have found that are either underway or are in the recruiting phase. So you see it, and it crosses the gamut. I love that the Michael J. Fox Foundation gave Yale University $2 million to look at depression in Parkinson's patients. And then PharmaThera's, a private company, is looking at reducing dyskinesia, the halting, jerking movements that's often levodopa induced. So looking at reducing that in Parkinson's patients as well. MDMA, there was one study that MAPS did as it related to people toward the end of life, and that one did not show a significant reduction they looked at anxiety. However, that also was a very small study with a pretty extreme outlier that really impacted the effects. But sunstone therapies, sort of in the forefront of a lot of this research, remaining in the forefront of a lot of this research, and they're located in Rockville, Maryland, has an MDMA dyad study underway where one of the dyad has cancer. The second individual can be a spouse, can be a significant other, can be an adult child, and they're both undergoing the exact same protocol, and that is pretty much following MAPS, where there are 3 MDMA sessions being preceded with psychotherapy, and then therapy following each of the 3 sessions. So as it's not a completed study yet, and the last time I looked, they actually were still recruiting, then what I found was this one article that Kurt Niemes wrote, where, as you see here, he has been able to sort of recreate his relationship with death, and also totally change or transform the relationship with his wife. And interesting to me, he says it no longer feels like work, which I thought was kind of an interesting statement. 5-MeO-DMT. As I said, there's probably people on this call that know a whole lot more about this than I do, but I wanted to include it as an option just so people are aware of it, because I know of doulas and other people working underground that love to use 5-MeO toward the end of life, because it is a very short journey and it can produce that unity, consciousness feeling that help so many people toward the end of life. In this case, you see, well, the people that I know use synthetic 5-MeO. They're not interested in the toad venom, primarily because of the additional toxins that they don't want to introduce to anybody toward the end of life. And one of the routes or one of the ways to administer it is through a pipe that vaporizes the 5-MeO-DMT, making it easier instead of having the individual who may not be able to really, really deeply inhale. The vapor makes it easier for the individual to get the medicine. So the sort of quick summary as far as what I feel are the major differences. I think psilocybin is the most mystical, bringing issues front and center. Many people, especially with cancer, report confronting their cancer, and I'll have a couple of stories on that, and I'm sure all of you who are facilitators and work in this environment have seen that over and over again. Ketamine puts you more into an observer mode because, again, it's dissociative, and you can separate your mind from your body and take a more objective look into what your issues are and help resolve them. And like I said, really, really helpful in treating chronic pain. MDMA, really useful for deepening or repairing relationships and for self-compassion for people who can't seem to forgive themselves as they're getting toward the end of life. And then 5-MeO, there you see the God molecule, and potentially putting you into touch with that place that you're going to. This is a really rough guide that I sort of just put together after talking to so many who've worked in the field, including some of you who are on this call, representing facilitating journeys to thousands of people. I mean, I just, first of all, I honor all of you that do this work. And so what I've learned, and again, this is a very rough guide, is that MDMA, people like to use it when their clients have been more recently diagnosed. It is a little bit harder on the heart. After all, the MA and MDMA is methamphetamine. So upfront, and then at least a couple of the people I've talked with, they like a lower dose than what you see out of the MAPS protocol. So starting with 80 milligrams and then potentially a booster at 40 milligrams. Psilocybin, again, more closely related to when an individual is recently diagnosed and down, and then on that continuum. And many people, depending, of course, a lot of this depends on whether your client is psychedelic naive or whether they are a psychonaut or somewhere in between. But starting with a lower dose is generally recommended, and then adding boosters as needed. I have talked with several people who have facilitated journeys when an individual is really close to end of life. And by that, I mean within days. And sometimes they start with half a gram and then add as they go on. And at least the folks I've talked to, they've never gone above 2.5 grams of dried mushrooms. So interesting. One of the things, though, about people toward the end of life that I understand is that it's paradoxical, where metabolism may slow down so that they're not able to metabolize the psychedelics as well. And there can be a danger there, or their systems are so frail that you do not want to give them a whole lot. There was a gentleman, an end-of-life doula, who's a licensed facilitator in Portland, Oregon, and he had an older gentleman, he was either late 70s or early 80s, who had come into his service center. And they administer the analyte at measured in milligrams. So basically, 15 milligrams would equal about 1.5 grams of dried mushrooms. So he started low, the facilitator started low, but there was absolutely nothing happening after an hour, nothing happening after 2 hours. So he administered more psilocybin, nothing happened. Now we're on hour 3, and administered more psilocybin, and then it hit the client. And it was a really really traumatic journey with a lot of vomiting and diarrhea, and a 13-hour journey, as it turned out. And so one of the physicians I talked to said, you know, his recommendation is, if there's nothing happening, there's nothing happening. Don't keep giving an individual toward the end of life more psilocybin. So that's just at least from one physician's viewpoint. 5-MeO toward the end of life. I understand it's better, again, to start low, go slow at 5 milligrams, and maybe add another 5 milligrams, and maybe another 5 milligrams. Well, in this case, 5 milligrams allow the arc of the journey. So that's 15 minutes, 20 minutes. And if the person wants to go deeper, didn't have a journey that they felt they really wanted to have, try again with another 5 milligrams, maybe titrating up. The bottom row there are is ketamine, which I feel can be administered depending on dosage just about at any time. Microdosing, of course, highly efficacious for some of your clients. And then there's other alternatives. If you feel your client is not able to manage a psychedelic, at least not at that point in time, then a cacao ceremony, Casina, the goggles that put you into a deep meditative state, can be excellent as well. So just a little bit about this in terms of mystical experience. And I really think that people toward the end of life, more so than those of us who are undergoing journeys much earlier without our mortality facing us, are really open to mystical experiences. And we know that those mystical experiences are correlated to the therapeutic benefit. Dr. Ira Byock, some of you might know, really well-known palliative care physician and psychedelic researcher, really helped to explain why psychedelics, and well, in particular, he's talking about psilocybin here, is so therapeutic. And it's because it's the experience of the psychedelic during the journey, confronting your own mortality, shifting your relationship with your mortality, experiencing consciousness that's beyond our physical bodies. And it's the memory of that experience that is the anxiolytic, so the anti-anxiety that lives on within us. And, you know, we hear that time and time again. Oh, let me say this first. So one of the things that I'm sure you all know, that when working with anybody toward the end of life, really, really, really important to collaborate on a team and to pull those individuals in that are really going to support and help you to make a decision as to whether or not this individual will be benefited by a psychedelic journey. So medical clearance, there are physicians I know that will work with clients or with you as a facilitator to help determine whether a client is okay to undergo a psychedelic journey. I put Ben Malcolm's photograph there. Many of you know him as the spirit pharmacist. He is a psychiatric, board certified psychiatric pharmacist who specializes in consulting for individuals undergoing or contemplating undergoing psychedelic journeys. If you feel your client can benefit from a chaplain, there are several chaplains who also can support. And then, of course, if you feel they need a psychotherapist or social worker, please bring one in. And I'm a big fan of end-of-life doulas. This is one of the big reasons why I founded end-of-life psychedelic care, is to advocate for and to bring end-of-life doulas onto the care team. And then the need for collaboration with family members, and we'll come back to that because, as many of you know, they can throw a monkey in the wrench or whatever, a monkey wrench into the situation. Come back to that. So as far as contraindications, they are all the same across the board. And I think the big thing you just have to be aware of is, as these people As our diseases may progress, of course, how severe is our heart disease? How severe is our liver or kidney disease? Ketamine is a little bit different than psilocybin, for example, and really can affect the liver and the bladder more so than psilocybin. MDMA, of course, as I already said, you know, as a methamphetamine type of substance, can impact the heart more so than psilocybin or even ketamine. And then for patients undergoing chemotherapy, you know, you need to look at it on a case-by-case basis. We know individuals who, in fact, I'll give one example of an individual who loves to use psilocybin to help him with his upcoming chemo sessions, and he likes to schedule them 2 or 3 days beforehand if it's possible. And the other thing that I absolutely love is that many of the things that the clinical trials have ruled out, including SSRIs and SNRIs, and these other mental health disorders are being challenged, as now we'll see research being done for folks with bipolar disorder or borderline personality disorders, and schizophrenia for that matter. So I just wanted to share a few real life stories, and I'll start with Roland Griffiths. I'm sure there's just about all of you who know who he is, but for those of you who don't, he is like the preeminent researcher. I don't think any of us would really be here if he hadn't done what he did in this field of psilocybin research for cancer patients out of Johns Hopkins. He passed recently. He was diagnosed with stage 4 colon cancer at the end of 2022. Prior to that, he had done psilocybin studies on long-term meditators and found that they fared better, and they did better on psychosocial scales 4 months out from the psilocybin sessions than did psilocybin users alone. And he feels that this was really important. He was a lifelong meditator, and when he was first diagnosed, he didn't really want to undergo a psilocybin journey. And as you can imagine, during his long career as a researcher, he really didn't do psychedelics, and he didn't feel as though he needed to with his meditative practice. He felt it was like a psychedelic journey anyway, and he really had come to terms with his cancer diagnosis. You see at the bottom there, he said, you know, it helps him deal with the present reality. He has one of gratitude toward his cancer, and it filled him with joy and love. However, he did decide to undergo a psilocybin journey, and I want to read from you kind of what he said. And first of all, he asked himself, was there something I am not dealing with? So then he asked the cancer, what are you doing here? What can you tell me about what's going on? And he said, I got nothing back. Then I wanted to humanize the cancer. And I said, I really respect you. I talk about you as a blessing. I have had this astonishing sense of well-being and gratitude despite everything that's happening. So I thank you. This process, is it going to kill me? And the answer he got was, yes, you will die, but everything is absolutely perfect. There's meaning and purpose to this that goes beyond your understanding, but how you're managing that is exactly how you should manage it. So then I said, okay, there's purpose and meaning. I'm not ungrateful for the opportunity, but how about giving me more time? He goes, I got no response to that, but that's okay. So a real testament to the man, obviously, and his practice, and why, again, we think that psilocybin or psychedelics are really just another tool in our toolbox to help individuals come to terms with their death and dying. And I'll share a couple of stories. I'm mindful of time here, but I'll jump down to Thomas there. Thomas is the gentleman on the right, photograph on the right. He is one of the first Canadians who was approved for psilocybin therapy back in 2020. I love Canada has a program now called Special Access Program, where physicians can apply to Health Canada for their patients who have a severe or life-threatening illness to be approved for psilocybin. And you can, if approved, then you can undergo treatment one-on-one with trained psilocybin facilitators, typically trained through TheraPsil, and or group therapy. And Roots to Thrive is one of the facilities in British Columbia that have supported dozens of patients through this process in a group therapy model. Since 2016, when Thomas was first diagnosed with stage 4 colon cancer, he has undergone 7 psilocybin journeys and 86 rounds of chemo and several surgeries. This man, from a physical standpoint, has undergone a lot. He attributes psilocybin not for curing him. He is not cured, but for allowing him to deal with his disease and to outlive his initial 18-month prognosis to live. Now he's going on 8 years. It's phenomenal. So he has a similar story as Roland, in the sense that he had a conversation with his consciousness. And I've had the good fortune of talking with him 4 times now. And I will be I will be publishing an hour-long conversation I had with him as soon as I can edit it. And the man has so much wisdom. So one of his stories has to do with confronting his consciousness. And he thinks of his consciousness now as almost me. And he asked it something similar. He said, "Why are you here? I do not want you to be here." And his answer from consciousness was, "Do you think I want to be here? I don't want to be here as well." And so Thomas came to the understanding that his cancer was as much a consciousness as anything else. He has come to really understand that there is no separation, which is why he calls the consciousness almost me. He says, "How can I fight with something that's almost me? I cannot win a battle with myself." So he has come to terms with it in the best of ways. There's so many more stories that this man has shared that hopefully, yeah, you'll all get a chance to listen to when I do get it out there finally. A couple stories on ketamine, because I think this is just so important. And I'll jump down to the VSED patient. For any of you that don't know, that means VSED is voluntary stopping eating and drinking, and it is a really humane way for people who choose to end their own lives. However, a son went to visit his 74-year-old mother and found that she was in the middle of VSED. She was still okay. Of course, he was very concerned with her, and he got her into hospice, actually. Kind of against her will, I think, initially, but she wanted to die because she was suffering such severe chronic pain, and she was also in severe depression. Well, 5 days as an inpatient with infusion therapy, and that is one of the standard protocols for severe chronic pain, is an inpatient infusion, turned her life around. Absolutely turned her life around. This woman would have been dead without ketamine, for sure. And she's been now back out in the community doing those things she loved. And her opioid prescriptions are now PRN, and she really doesn't, she only uses them when she needs them, as opposed to basically living on them. I'd like to tell you about my friend Patty. She lives here in Sarasota, and about 6 years ago, she was diagnosed with stage 4 head and neck cancer. She fell into such a deep depression that she didn't leave her apartment. She turned to ketamine when I started making presentations, I was only talking about psilocybin. I wasn't even aware of ketamine and its therapeutic benefit for people diagnosed with cancer. But she turned to ketamine, and as many of you might know, ketamine is fast acting, but short lasting. And so many people, to start off, undergo 6 loading doses, many times either IV or intramuscular injection. So after her first loading dose, Patty felt her mood beginning to lift. After the 6th loading dose, she experienced what she actually called joy. She went out and she got a job that she holds to this day. However, fast forward about a year and a half after that initial ketamine set of loading doses, which, by the way, she went and she either got boosters in infusion form or took at-home lozenges to maintain management of the depression and anxiety. But the disease progression took her toll. She had neuropathy and trigeminal neuralgia because the radiation burned a hole in her jaw. And the ketamine, again, at higher doses, helped her manage the pain along with at-home lozenges. She does use them rectally, and she's managed to be able to she manages her pain and has kept her job. So just a phenomenal story there. And then on the 5-MeO DMT, this is Mary's client. Mary's an end-of-life doula working out of the Los Angeles area, who was really close to end of life and was really, really afraid of dying, afraid that it would be painful for her body to separate from her spirit. And as she was in the middle of her journey, and I love the way, I'll do it the way Mary describes it, her client was like going, separate, separate, separate. She kept saying that. And so when the client returned, Mary asked her, what was that all about? And she says, I felt my body separate from my spirit. And so Mary asked her, well, was that painful? And she says, no, no. So she lost her fear of dying and that it would be painful. So again, there's hundreds of stories, and I know you have hundreds of stories, and it's just phenomenal for any of you who wants to work in this space or want to work more in this space. So I want to switch gears now and talk about serving clients toward the end of life. And I found this, and I actually, I think of this as an end-of-life doula. This is Earth Angel by Charles Gibbs, and I absolutely love this illustration. A lot of times, and this is my bias, so forgive me, but a lot of times, and this happened when I went through my own facilitator training, we always think in terms of preparation, the journey, integration. And for anybody working toward people toward the end of life, and for all of you that already do, you know exactly these things don't fit into buckets. And so what you really, and it's up to you to choose what it is you feel comfortable bringing to your client, and it doesn't have to be everything, but you find that you are the patient confidant and advocate. That doesn't happen with 1 or 2 or 3 preparation sessions. You are there for that individual. You can, in fact, help with legacy planning, those kinds of routine things. You are clearly a family counselor and mediator most often. You provide grief support. If you choose, you are that coordinator, that lead coordinator for a collaborative team, and a holistic practitioner, as we'll talk about some of these practices. And of course, you can be a facilitator where you do help prepare and you sit or you guide, and then you provide follow-on support. What's important here is you all would know you're providing that follow-on support for the duration as long as that client needs you. You may also decide to facilitate a family journey if the client and the family so decides that's in their best interest. You may then decide also to sit vigil. I know end-of-life doulas who don't even sit vigil. They like to do everything else but. And then even beyond this, there are doulas who help prepare the body for a home funeral and oversee a home funeral. So many, many, many roles that don't fit into buckets, that don't fit into a 50-minute psychotherapist appointment. You know, when you're with your client, you are with your client. The intentions, I think, one of the things for anybody who wants to do this work, a lot of the reasons why your clients wants to undergo a psychedelic journey are true across the board, no matter what stage of life you're at. But I think for anybody toward the end of life or with a life-threatening or terminal diagnosis, certain things come to the fore. So yes, easing anxiety and depression because of the fear of dying, reducing chronic pain, especially if you are suffering from depression, overcoming the fear of dying. And I guess this can be thought of almost like a Maslow's hierarchy, not necessarily linear, but that as you come to terms with death and dying, I think then you're looking for more. And for certainly somebody like Thomas, who's been able to experience several psilocybin journeys and move through a sort of progression here, you can find meaning and purpose in the present moment, experience oneness with the universe, and really, really, really totally cool would be to have that glimpse, to live, to embrace into whatever you feel that next place is, and to look forward to it with awe and anticipation, not fear. So lots of wonderful, wonderful reasons to use psychedelics, which by the way, you can substitute the word meditation in there as well. And many people derive benefit from meditation alone. You also, as you know, have to deal with several issues that come up for most of us, but really come up toward the end of life. Religious beliefs, you know, one of the toughest things, if you've had the fear of God instilled in you and you think you're going to hell, this is where if you don't feel comfortable being able to deal with a client and some of their issues, to bring in somebody like a chaplain to work with you. Family dynamics are a huge issue. And again, I'll come back to that because they can potentially stop you or the client from supporting your client on the psychedelic journey. As you would know, clients felt like they're losing control when they get something like a cancer diagnosis, and now they're also afraid of losing even more control under a psychedelic journey. Feeling like a failure, feeling like, all right, I failed. I don't want to die. This body is failing me. They feel a failure both to themselves and to their family. And then there's the whole issue of forgiveness, forgiving themselves and forgiving others comes to the forefront as they contemplate end of life. And then I think too, to keep in mind, I love this again from Dr. Ira Byock. He talks about the 5 tasks for living. Well, 5 tasks for dying, which is a recipe actually for living, and all things that we all should be doing, which again, asking for forgiveness or offering forgiveness, offering heartfelt thanks, offering sentiments of love, and saying goodbye. And these are the things that you are helping your clients do through the use of psychedelics and the supporting holistic practices. So, okay, so having said all that, what are some of these holistic practices that I feel are really, really, really not just important, but that any of us can do and be supportive with our clients? And first off, taking care of yourself. And I absolutely love this. This was developed, sort of program called Grace. And it was developed by Roshi Joan Halifax. And most of you may be familiar with her name. That is a woman who was married to Stan Grof for a period of time. But she is a Buddhist master, and hence the name Roshi. And she developed this program in terms of first taking care of yourself, This is true for any work you might do as an end-of-life doula or as a death worker, but then also when you're working with psychedelics. And so to be able to first ground yourself and come into the present moment, and this practice can be done before, should be done before you meet with any client, should be done after you meet with any client, should be done as you close the container on a specific moment with that client, and of course done if you find yourself in the midst of chaos between the family and the client, with a client who's in an agitated mindset, or if you find yourself in the parlance of internal family systems, blending parts with your client to be able to step back and say, listen, I've got to deal with myself and come back into the present. Remember means recalling your intention to serve, recalling all the talents you know you bring, all your training, all the resources that you have, and then you use that to attune to self and others. I think for people who are first coming into this, we all have doubts about our abilities. And I think for any of you who have then tackled that and gone on, you know, the best thing to do is just to plow through and understand that you bring the best that you have and your client will benefit. So I think as you do that, you're able to better attune to both yourself and to your client. And then you're able to intuit what will serve. And even if you make a mistake and you then understand your client and you course correct, and it's just all okay. You bring curiosity and discernment into the process. And when you feel that wherever you are with the client at that point in time is whole and complete, you close the container and prepare for the next one. So taking care of yourself first. So there's just a number of very, very, very simple breathing exercises or pranayama. And these are just a few that are all really, really good for people toward the end of life. That last one, that last point is just a thing I wanted to be able to remember. For all of you, as you come into the presence of a client, I can't think of a better way to start than either sitting down, holding the hand of the client and just beginning to co-regulate your breath, synchronize your breath, slowing the client's breath down and really becoming in tune with the client. So then the use of these other breathing techniques are pretty much as you can gauge the client. Most of these are basically used to calm a client. Some of them, though, can be used if you feel the client needs to be energized. The pursed lip breathing, for example, that's a simple one of inhaling in and then just exhaling with pursed lips, like I find this one really great if I feel my anxiety escalating. However, it's also kind of good if I feel like I need to energize myself and I want to deeply breathe in an oxygen to kind of bring up the sympathetic nervous system. Many of you then also know that on that inhalation, that is bringing into breathing life into the sympathetic, bringing oxygen in. The exhale is more the parasympathetic system, bringing you down into a calming mode. And so a longer exhale can help calm an individual. I absolutely love pelvic breathing. And for those of you who don't know, and I don't know that we're going to run out of time to practice some of these things, but this one I absolutely love. And I love this actually over belly breathing, where you're taught to put one hand on the belly, one hand on the chest. And if you can just breathe, as on the inhale, you just visualize your pelvic floor dropping, settling into the chair, or even just gently settling if your client is just lying in their bed, just feeling that pelvic floor drop. And then on the exhale, feeling a sort of the diaphragm coming up. I don't know. I just found for myself that it really, really, really helps with anxiety. This next one you might have seen or heard of, physiological or cyclical sigh. And this was studied at Stanford and actually has become a practice for some of the psychedelic research and clinical trials. Matthew Johnson, I know, uses this out of Johns Hopkins. And so physiological sigh has been shown to quickly reduce anxiety, severe anxiety. And that is a double inhale breath followed by an open mouth sigh. So basically you inhale once, and then you inhale quickly and expand your chest as far as you can take in oxygen. And then you let it out slowly with pursed lips. And you do that for 5 minutes. And according to Stanford research, that just takes the anxiety right away. So I think it's worthwhile trying with any of your clients and for yourself. Nadi Shodhana is one of my favorite out of the Ayurveda or Vedic traditions. It's a balancing technique, and many of you might be familiar with it, but it's simply alternating nostril breathing, also very good for people toward end of life. All of these are great for supporting lung capacity, expanding lung capacity for anybody who's a bit frail. And this one is simply where you put your forefinger and middle finger by your third eye, and you alternate breathing between your thumb and your your ring finger. I would just encourage you not to press too hard. I was going to have us do it, but I think I'll just keep going here. Oh, one pet peeve I will say, I like the longer exhale over this 4-7-8 breathing. Some of you may be familiar with this, where you inhale for 4, you hold for 7, you exhale for 8. I find even myself as a practicing meditator and breather, that trying to exhale for 8, it just takes me out of my body, and I'm trying to exhale and I can't, and so it just throws me off entirely, and it's just not worth it. The other thing that I find even experienced teachers doing is trying to count for you, and they screw up your own counting. Don't try and count for a client. Just show them how to do it, and then let them go at their own pace. I see this all the time on box breathing, where it's inhale for 4, hold for 4, exhale for 4, hold for 4, and the facilitator is trying to count for you, and it just drives me crazy. So let the client decide, first of all, their own pace and which of these types of techniques work for them. And for all of you who are experienced, you know this, but for anybody who's not, all of these practices need to be practiced multiple times before any journey, so that when you go into a journey, the client is fully comfortable and has these resources if they start to get anxious during a journey, as opposed to trying to introduce something right then. We won't have time to go through these things, but the picture on the right is my visualization for, I call it the tree of potentials, and I absolutely love it. On my inhale, I just breathe in all that the universe can bring to me. On the exhale, I breathe out all the messages I want to give to everybody, and it's going to fall where it's going to fall, and the people who need to hear it will hear it. So that's my visualization. The death meditation is a great one for anybody toward the end of life, and for anybody interested, you can Google that, or I'll actually, when I send out the slides, I'll send out a script for a death meditation. So this is really helping an individual come to an understanding of death as impermanence and can be very useful for somebody toward the end of life. I love this one. Tara Brach, if you don't know her, she's a major spiritual teacher, meditation teacher. She's the one who interviewed Roland Griffiths from that quote, that story I got that I was reading earlier. So she's fabulous. Rain is a great meditation, a guided meditation for anybody who is feeling a lot of anxiety, can't forgive themselves for something they did during their lifetime, and they really do need to forgive themselves. So rain is a guided meditation that helps them first recognize and then allow, accept, honor that this is their feeling, investigate it, what's behind this, begin to shift the narrative as far as, is this really true? I mean, am I a failure? Have I not done something that I can be proud of? Is this really what people have been telling me? Begin to shift that narrative and replace the positive narrative with the negative feeling, and then really nurture it and anchor that feeling. So terrific. And that one you can easily Google by looking up Tara Brach and Rain. Casino goggles, I had mentioned this before. So if anybody that's interested, here they are. They bring on a sort of psychedelic altered states journey, but they can affect really deep, tranquil states with your clients. So if your client is not ready for a psychedelic journey, this type of a meditation aid is pretty cool. I know an end-of-life doula who, once she learned about this, she goes, oh my gosh, I'm going to go out and get these and offer it to my clients sort of as an added service. So something to think about. Somatic practices. I think this is something that I know has been really, really, really important for me. And so if I think about it for people toward the end of life, there are simple body scans that you can take people through where they think about and relax each part of the body very slowly as you go through it. But I think these next two guided visualizations are so important for clients toward the end of life. And one of them then, one is to move negative energy, and the other one is to really, what I like to think of as resourcing the transcendent. So the first one is an invitation to feel the distress in the body, for example, cancer, and really give it form, talk about it in great, great detail, and then decide how you're going to move it out of the body. So to feel it in the body and to move it out of the body. In part honoring it, but understanding and telling it it needs to go. So basically, and it's interesting, somebody else was telling me that they find that most of us disperse the negative energy into air, fire, water, or earth. And as I thought about it, that seems to be pretty true. So anyway, as a guided visualization, of course, it's your client's call as to whether or not they burn whatever they want to burn as the negative energy they're getting rid of, if they want to bury it, if they want to send it into the universe and explode it. But that is a really, I think, important guided visualization, and I can send out a script for that. And then on the flip side, for anybody to bring back and resource a feeling, that purity of bliss from a journey, or if not possible, then from the very best day of your life. So this is somewhat similar in the sense that you guide the individual towards that feeling, that embodied, that felt sense. Feel where it is in your body, put your hand over that part and describe it in great detail. Of course, in this case, you're going to want to infuse your whole body with this great feeling. and extend it out as far as you want to send it. And this one is harder to come back from. I know anybody who's done this kind of a visualization, you kind of feel like you want to stay in it. So, you know, you and your client take as much time as you want, and you bring the client back really slowly. And I've got one from the Deepak Chopra program that I'll send out as well for this. So the other thing here, I know when we go through integration training, facilitation training, there's a lot of emphasis on touch and the need for consent, which is really, really important. But I also want to point out that your clients are people who are poked and prodded, and many people don't even want to hug them. And they crave touch. And so always an invitation, but there's so many things you can do, I think, not the least of which is just guiding self-touch, having them bring their hand to a place, whether it's on their heart or to a place wherever they want to provide comfort. But to be able to massage hands, feet, forearms, shins, and of course, for anybody toward the end of life, well, I could speak for myself, everything is dry. To be able to massage lotion or oil into those parts of the body is just so, so, so cool. And again, you don't need to be a massage therapist. I wanted to mention this last thing because I just started to learn about it. And I know there's a place in Oakland that offers ketamine assisted therapeutic massage. So for anybody that can travel, or for anybody who's can do therapeutic massage, doing it on ketamine really allows therapists to get deeper into the tissue and opens it up more. It's just like, you know, in IFS, we talk about ketamine softening the parts. Well, that's in this place, in this sense, ketamine's also softening the parts, but it's the body part. So totally cool to release trauma. All right, energy and body movement, something that everybody can do. A restorative yoga, unless you're a yoga instructor, I wouldn't recommend doing all the poses, but I love this child's pose. And if you've practiced it ahead of time or anything like this, where you know your client might need self-soothing during a journey, and they're able to get into this kind of a pose during a journey, great. I love chair yoga. So many great videos on chair yoga where you can synchronize your breathing with the movements of inhale and exhale slowly, sort of like a Tai Chi thing that is just so, so soothing. Reiki techniques. There's a great story that another end-of-life doula told me. One who works, goes to a hospice house and works with patients, and she's typically followed around by a nurse who saw her doing the Reiki and really says, "What are you doing? This is so cool." And the nurse, without having any experience at all or training, was invited. The doula invited her to go ahead and just place her hands over the client and just breathe with the client. And she asked her, "Well, what do you feel? What do you see?" And the nurse said, "I see this long script unfolding. And it just keeps unfolding and unfolding, these rolls, script rolls, unfolding. And she says, "Oh yeah, your clients are, or she's in her life review, and you can sense that you, with no training, can really begin to tune into the patient or the client and really begin to have that attunement going without any training." So then even though I said there's really no preparation integration, well, there is preparation in the sense that this is where I think, you know, special attention has to be played or put on with the family, where you have to educate the family what is going to happen with their loved one. How may that change? How may it change their loved one? Hopefully you can get family consent. In some cases, depending on, this is totally up to you. Will you go forward if you don't have family consent? Or will you go forward if they don't give you family consent? So then family group discussions, bringing them back together after a journey and helping them understand again the shift in their loved one. Taking a family member out of the room if they are agitating your client. One doula I know actually gives the family meditations, say, here, go do this meditation before you come back into this room. And the other thing that I think is important to realize, that people are doing integration in real time, especially when they're really close to end of life. They feel something, they feel that relief, they feel that consciousness, they feel that unity. That's it. They're done. They're ready. They're not going to come back and talk about it. It's not that important. It's been embodied. So anyway, all right, my last slide. Some tough questions. Let me jump here, and then I'm going to stop sharing. I just want to mention that one of the things that I do are all of these free webinars, and I do it for the community, for hospice agencies. I've done it for oncology centers, so I do it across the board. I'm talking to a couple of hospice agencies on Wednesday. We provide end-of-life doula training. We provide topics. I said we're in the middle of doing one on meditation now. We're going to do one on bereavement. We're going to do one on spirituality. So a lot of different programs relative to that intersection of end-of-life and psychedelic care. And then you'll get these, again, you'll get these slides, but there's a couple of YouTube videos we have that if you're interested, you can do a deeper dive with an end-of-life doula, or I've got 5 experts talk psychedelics for end of life. And then for anybody interested, I encourage you to join this Google group called Palliative Care Psychedelic Therapy. Really great group of people. And what we've been doing, we have a monthly call, and what we've been doing lately is sharing case studies. Now, this is all above ground, so we're getting physicians to talk about their patients with ketamine therapy. So I'm going to stop sharing, but one of the things, that's really important, I think, is for each of you to decide what I'm going to do, with whom I'm going to, how, am I going to facilitate? To what degree am I going to facilitate? At what point do I facilitate? And are you comfortable with working with somebody who's really close to end of life? There is always the risk that somebody could pass. How are you going to protect yourself? And so, yeah, I'd like to kind of first acknowledge that. And again, those are really, really tough questions, and to kind of open it up to either questions around that or comments around those specific types of questions. So yeah, what comes up for you? Yeah, Abby.
Hi, so nice to
Hi.
meet you. This
Nice
was
to meet you too.
this was beautiful. And I'm super enrolled and honored to be a part of this group. I do work in psychedelics and I work in a group with major depression. But I actually got engaged in all of this because I lost my brother and my father and recognized what a gift it would have been for them, not just for their safety of feeling what it will be like to really like move on into the next realm, but it would have really helped my family because sadly they passed with their diagnosis. So
Hmm.
one of the gifts was learning to be a grief coach, really learning to sit in this space. And as I listen, I think to myself, ooh, do I need to become a doula? Do I need to really start to empower other areas in my life so that I can be my fullest self? So I guess the question to you then becomes, is this something that you think would really help move forward in this work? Because as a grief coach, and I work with many clients, but not in psychedelics, more so in loss. Um, are there courses that you're offering that are more immediate, or is there something? I know that I'm going to reach out to you separately, so I don't want to monopolize the space. But your suggestions would be
Well,
really.
well, yeah. Well, I definitely appreciate you asking. I think anybody who wants to work with individuals toward the end of life, an end of life doula training course is good because it just gives you an all-round understanding of what the death and dying process is and how you can support them in a non-medical way. What are comfort measures, for example, how you can educate the family. If you want to do some of these things like advocate for your client, how do you do that? And that if that's in the form of legacy planning or making sure they have their advanced directives done. So yeah, there's just so much I think um, to learn, and it's a step. I mean, for any of you who are already doulas, I'm sure you would agree. And please pipe up that starting with an end of life doula training is just the start. When I launched the nonprofit and thought, okay, we're going to start with end of life doula training with a plant medicine component, and then I offered a core course, and I'll be doing it again. It's a basic introduction to psychedelics with a filter on end of life, but it does include things like Ben Malcolm will come and talk about health considerations and screening and assessments specifically for this population. So you can do a deeper dive specific to people toward end of life. And then these other programs like meditations for end of life or spirituality for end of life psychedelic care. I'm going to do one on ketamine. We're talking, as I said, about bereavement, as you know. And so taking those deeper dives into topics specific to it, and in collecting, I collected a lot of feedback from the people who have taken the courses to say these are the things that are important, I think. So yeah, you become a lifelong learner, right? But there's nothing like getting out there and just doing it, and knowing you're serving your client the best you can. I don't know if that answers your question, but yeah, just start.
Thank you.
Yeah, what else comes up? Hi, Deb. Grateful Deb.
Hi, Christine. That was so incredible. I've seen probably all of your presentations. This was just amazing. And it
Oh,
was so
thank you.
filled, it was so filled with so much incredible information. I have a couple of comments. One is that, it really is the end of life doulas that are really making really just we're doing things that other people don't and won't do. And it's so important for us to keep a presence in the psychedelic, in the movement towards psychedelic decriminalization or legalization, or how we're using this with the general population, because doctors aren't the ones who take these risks like we do. We're the ones who sit with people on those 13-hour journeys, and physicians won't be doing that. And they haven't been doing that. They don't do that. So it's really important that you make your presence known in the psychedelic and medical community. And just like you said, some people will choose a medical route to this. Some people will for sure not choose the medical route. They're already filled with PTSD from loads of treatment and whatever their life has brought them to up until their diagnosis. There's so many factors that create diagnoses in people all the way. They've endured so many things. And the other thing I want to say too is about Roland Griffiths, because I met Roland Griffiths when I was in the psilocybin cancer study, and I'm clairaudient. And you know what I heard? I heard he doesn't know this. I really haven't shared that too much. There's a lot of stuff I heard when I sat with Roland. He doesn't know this. And I thought to myself, when I found out that he was diagnosed, and I think Abby and I found out about that around the same time we were in Europa, and it was the summer of 22. And I remember thinking, well, now, I wonder if everything's going to change for him. And I was hopeful that it would change for him. And I'll joke around that his last words were decrim now, but they weren't his last words. And I have to say that he had amazing intentions and he was a lifelong meditator. I'm so glad that you brought up those comments that he said he didn't feel that he had to do that. It's amazing how there are just lots of people that feel like they've gone as far as they could. They're real happy in their comfort zone. And you know what? That end of life diagnosis, that will just push you right out of your comfort zone. So you're either, pulled by what you want or you're pushed by what you don't want. And that's how it goes. And I'm loving that you offer this so people right here today can choose for how to participate for what they do want and choose to enroll in your classes and choose it if you're already using psychedelics in your practice to donate a session to serve medicine, where we're serving people who have an end-of-life diagnosis or a life-threatening illness with a free donated session, or if you want to give us money. And same thing for Christine's organization. Give her some money. She's got a great organization. She does an incredible amount of good. And I'm so appreciative to everyone here just for joining and listening. So big loads of gratitude. Without you, this space wouldn't be as full.
Oh, thank you. And I did not pay you to say that, but thank you. Grateful Deb, because she's a deadhead, major deadhead. Okay, Erica, nice to see you.
Hi, hello.
Hi there.
So I guess I just have a few questions. One is I knew I've had a calling to really become an end of life doula, but I really have not started to, start putting everything in the plan. I recently did ayahuasca in Costa Rica, and I was told during while I was sitting with ayahuasca that I was to help lead a lot of colored people to plant medicine. So I'm just like, okay, so I really that was my confirmation. So I was just like, okay, I really need to start taking these steps. However, now that I'm doing research, it's just it's kind of overwhelming because there's so much out there. I'm grateful that I found you because this session was amazing for me. It really was very informative and amazing. So I guess the question is with all there's so many resources out there, is there how do I know what's going to be fitting for me or where to start? And then if there's any type of education background that you think, especially with this being here in our country, just as it starts to get legalized, is it going to be more of a medical thing where you need a license or some type of doctorate degree, or do you think it's just because I really just want to be able to facilitate it, but do you see it kind of going that route where you would need further education, if that makes sense?
Well, let me see if I can answer it correctly. First of all, where do you live?
Oh, sorry, I live in Indianapolis, Indiana.
Oh, that's right. Okay. Yeah, I don't know. You'll see psychedelics legalized there anytime soon. So, well, I'm obviously a big fan of education, but not that you have to be a licensed professional in order to do this work. We know that in Colorado, you needed to have a high school education, and then undergo their state approved training, which I think is really great. I can get into trouble for saying that because many people, and I feel this especially in this field, clients aren't looking for a psychotherapist, they're looking for a doula. And to Deb's point earlier, so I don't think you have to necessarily be a therapist, although have at it if that's the type of education you want. So, but having said that, if you're not going to go the therapist route, then there are programs to learn to be a facilitator where you don't have to be a licensed therapist. And that would include the third wave, for example, and I'm not going to remember all of them. I mean, the program I took through Psychedelics Today, you don't have to be a licensed therapist, like the ones well, Naropa you didn't either, did you, Deb? did you have to be a licensed anything to go to Naropa? No, Abby's shaking her head. No. Okay. No. So there's Naropa University, which is one of the really great ones, but a couple of the other ones, like the Integrative Psychiatry Institute, or CIIS, you have to be a licensed therapist. So those two are out. You know, if you have any intention of moving to Oregon, or anybody else who is in Oregon contemplating facilitator training, I would only do the ones that are licensed for the state of Oregon. Similarly, I wouldn't, if I were in Colorado, I would not sign up for any training yet until the state of Colorado decides which ones they're going to approve. Just to make it easier. And then but if you're anywhere else and you want to go through facilitator training, find one that is MAPS approved, and Fluence is MAPS approved. Although I think you might also have to be a licensed therapist for that. But at least if you go through a MAPS approved training, then you're more than not guaranteed to be able to work with MDMA once that becomes approved through the FDA. I'm not sure if I'm answering your question, because there is just like when Abby had asked a similar question. Basically, but anyway, you can email me offline, and I can give you some more.
You are answering my
I
question.
wanted to
So
add
thank you.
something, which was that if Abby and I didn't have a lot of background in the work that we do,
Sorry.
I don't think we would have gotten into Naropa. It was vastly people who were certified and licensed, licensed or physicians. So
Okay.
we have a lot of history of work in this field. So in grief or in psychedelics, but the places that you mentioned, vital, and there's lots of great training classes. I would recommend being trained no matter what, and apply to Naropa. Absolutely try and see what they have to say about it. But I can tell you this, in a class of maybe 100, under 110 people, there were maybe 5 people that weren't licensed in that class.
Wow. Yeah, interesting. Dawn, Marie, did you want to say something?
Actually, I was kind of thinking about, as a cannabis nurse and a long-term care nurse, I was constantly put in situations where I was, doing hospice work. And then I got to a point where we didn't have this sort of training. So I trained as a volunteer with hospice. What I wonder is, we're this close to cannabis legalization, and hopefully they'll, do something with it, at least to a Schedule 3. But then the death doula and the psychedelics and everything, and psychedelics seems to be taking a quicker path to legalization than cannabis has. But I'm like, eventually this will be like an adjunct to hospice care, don't you think? And be handled through insurance companies. Or do you think
you're
it'll
talking
forever
about
be like
psychedelics or cannabis?
both?
Both.
Both.
Yeah. Yeah. The thing is I hope to see it in my lifetime, right? Because
Right.
I just was discouraged. I don't know if you know Emma Beckerly. So there was a friend in the cannabis space who just reached out to me, and she wanted a connection into hospice agencies in New York. And so I reached out to a hospice physician, and what she wanted was a cannabis educational group wanted to go in. And I kind of was suspicious of this, but I said, yeah, I'll ask. Sure enough, the hospice physician comes back and says, there's no way. There's no way they're going to entertain cannabis education at the hospice agency. So, it's shocking, really. It's really unfortunate. So I think it's going to take some time. And whether or not, it remains to be seen whether or not psychedelics really move faster where it needs to move faster than cannabis. I don't care. Well, I guess relatively speaking, but you could look at psychedelics as having been around since the 50s and 60s, and it's, we're still waiting. So yeah, I don't know. One of these days it will, but even with ketamine legal as it is since 1970, lots of hospice agencies don't touch it.
That's interesting.
Yeah, it's sad. It's really sad. So anyway, well, hey, we gotta leave this on an up note though. But but nonetheless, the work that you all do is just so important. And I salute you all, and you will get the slides and a recording, and you know then how to reach me. And I wish all of you a really great rest of your day. Bye.